Welcome back to the Elder Law Question and Answer series. My name is Michael Rose. I'm really excited today to introduce you to James Welch and Rachel Davis. They are with First Call Home Care, in-home care, and home health care, right? There's all these different parts to First Call, which I love. So first of all, today we're going to be talking about what the difference between in-home care and in-home health is. Did I say that right?
Yeah.
Okay. So I'd like to just find out a little bit more about what the difference is, because I hear this all the time, in-home care and home health care, and it's actually kind of confusing.
Well, the definition is just the difference, and it is that home health is considered curative and rehabilitative care. And that means that nursing is curing a wound site from a person's surgery. Rehabilitative means that physical therapy, occupational therapy, speech therapy is assisting a client in rehabbing from a stroke, a fall, any sort of those events. In-home care is a service that's based around stable and predictable assistance in a client's home, basically. And that'd be like assistance into and out of bed, assistance into the shower, meal prep, cooking, things like that are what in-home care is the basis for. So
okay, in-home care is to take care of daily activities of daily living.
Absolutely. Yeah.
Right, and then home health is more of the medical side of things.
Yeah, absolutely.
Okay, all right. So when and why would you order home health then?
Well, a person would order home health. First of all, a doctor would have to write the order, and a lot of times patients are either discharging from a hospital with maybe an acute exacerbation of a symptom, or if they've had a new medication, a new procedure, a new medical equipment. Those are all reasons why home health could come in and do teaching and also take care of the other medical needs in the home.
Okay, great. And why would you, on the flip side, want to order or call for home care?
People call for in-home care usually after an event, a fall, and something wasn't seriously injured, but someone wants to have some stability in their home and they want to make sure that they're okay. So a lot of times what will happen is a client will just phone the service and ask for us to come in. They tell what kind of hours and days they're looking for. There's no doctor's order required for that piece of it.
Okay.
And it's essentially just to make that person comfortable. Sometimes it's not even for assisting with anything ADL related. It could be based on them just wanting some companionship.
Oh, okay.
Maybe there's some cognitive issues or whatnot, but it is really just a at your service type of service. So.
Okay, so it really sounds to me like home care, you could really have that for as long as you need it.
Absolutely. Yep.
But is home health the same way? Can you utilize home health for as long as you need it, or are there any restrictions on that?
There are actually. Medicare requires that you meet certain criteria. So
Okay.
as long as you're homebound, as long as you have a skilled need, so something that a nurse or a therapist, physical therapy, occupational therapy, needs to be treating, and as long as it's part of a care plan that a doctor has ordered, then yes, you can continue to receive services for home health.
Okay. We're talking about also with going back to the in-home care part, what's a typical episode for an in-home care client?
Well, I think it can be anywhere from a couple weeks for someone to come out of the hospital all the way to a couple years or more of actual ADL assistance or companionship care in someone's home.
Okay.
Again, it's something that they're requesting and the doctor doesn't have to be involved. And so it's sort of up to that client to determine how long they want the service.
Okay.
Sometimes family members will step in too. But it's, for the most part, it is up to the client's discretion about how the services are created. The care plan, everything is based around their needs, basically.
Okay.
So, yeah.
So home health really is dictated by the insurance or Medicare, and home care, in-home care, really is dictated by the client themselves.
Yep, absolutely.
Okay. All right, and so what are the requirements needed to qualify for home health care then?
Well, the requirements, basically, someone needs to be considered homebound, which means it's a taxing effort for them to leave their home. It doesn't mean they're confined to their bed or they can't leave. There's many reasons, doctor's appointments, religious services. There are definitely times where it is appropriate, for someone to be leaving, but under their normal circumstances of their condition, it's not recommended for them to leave.
Okay.
They also would need to have a doctor's order and then have a skilled need. So whether it's, they need physical therapy, a safety evaluation around their home, they just had a surgery, they just got a new diagnosis and need education about the progression of the disease, all those types of reasons. Every patient is different, so it really just varies.
Okay. And what about for in-home care? What are any specific requirements? Obviously, it's very specific for
So the
home
biggest
health.
thing with in-home care is the rule, and that is that it needs to be a stable and predictable situation.
Okay.
That's really derived from the care plan. We can't, it'd be like comparing home health and home care. We can't go in there with caregivers and attempt to give physical therapy, not being physical therapists, basically. So that would be unstable and unpredictable for us to be attaining or trying to do that, and for a client to be asking us to do it. So the model of it is just, as long as the service can be provided by that agency, it is that it fits within the means of the care plan that we can provide for them, basically. So.
Okay, so I imagine this is a big deal for, well, I know there's a lot of companies out there that provide only in-home care.
Yep.
And I imagine they probably get asked, oh, can you help us out with certain maybe medical needs? And they just can't do those sorts of things.
They can't,
So,
they shouldn't, yeah.
okay.
Yeah.
That's really important to think about, that maybe in the future if you're looking for these kinds of services, to think about a company that would provide all of those services. How about, as far as the cost, how does it get paid? Like home health, we've talked about Medicare and insurance. Is that how it's paid for, or?
It is, yeah. Medicaid, Medicare, lots of different insurances, the VA. There's many different ways that it can be paid.
Okay.
And then depending on that, right now home health is 100% covered by Medicare, but some of the other insurances, there may be a copay. It just varies.
You said 100% covered by Medicare.
For the home health benefit, it really is a true benefit.
That's great.
Yes.
Okay, and so in-home care?
Well, we're covered by private pay, Medicaid, and long-term care insurance policies. That's an important piece of what we do. Is a lot of long-term care insurances policies out there now, and you want to find a company that can really delve into that and assist the client with actually getting that benefit out of the long-term care insurance
Right, I imagine
policy.
receiving Medicaid to help out with that is a huge factor for a lot of people. How does home health help with like medications?
Well, home health, really our goal is to teach and educate and work with the doctor. So we're there to educate the patient on a new medication, make sure there's no interactions, or if there are, communicate with the doctor to make sure that patient is set up for success.
Okay.
But we're not going to be there, at every time they need to take the medication or ongoing for the duration.
Okay.
So it's short and intermittent.
Okay, and so is that something that like in-home care would pick up on?
In-home care actually can go to the fullest extent of medication administration, and that is that we are 100% handing the medications to the client under RN direction, and then actually monitoring that with a medication administration record. So we can do the highest level of, most in-home cares can do the highest level of in-home medication assistance basically with a client. And that is literally giving the pills to a client and then marking off that was done and creating a record for that. So, yeah.
Okay. So to me, this whole little segment has been about how in-home care and in-home health really kind of work together. But I'd like for you guys to just, I don't know if you can summarize really quickly, but how do you guys work together as a team then?
I think a good key point for us for the home health and home care side would be if there's a physical therapist who believes that a person that's not walking as well needs more assistance, or wants to train a caregiver on a specific way to transfer a client. It's a little bit easier when you have an in-home care home health agency to combine, that they're able to get those notes to, or actually show that person a little bit easier, basically. So, and I've seen that quite a few times. So,
Gotcha. Great. You guys, thank you so much for joining me today. I really appreciate your help. I know that there are a lot of viewers out there that really appreciate the information you provided. So, thank you.
thank you.
Yeah.